Black women around the world are more likely to die in childbirth than women of other races. But a recent report from the United Nations shows that the maternal mortality gap, as it's called, is especially wide here in the United States, the world's richest country. The UN looked at maternal mortality in 4 countries, the US, Brazil, Colombia, and Suriname. The US had the lowest overall mortality rate for women, but Black women and girls were 3 times more likely than their U.S. peers to die while giving birth or in the 6 weeks following. This comes as more families are responding to deaths with lawsuits. In Riverdale, Georgia, Jessica Ross and Travion Isaiah Taylor Sr. are suing Dr. Tracy St. Julian and Southern Regional Medical Center. Their baby was decapitated after the doctor applied excessive force on the baby's head during delivery. And in Los Angeles, Cedars-Sinai Medical Center faces a civil rights investigation. Charles Johnson IV sued after his wife, Kira, died while giving birth to their second son. An autopsy found she had massive internal bleeding following a C-section. According to the lawsuit, Johnson was denied proper care because of her race. Joining me now to discuss this crisis is one of the co-sponsors of that UN report, Dr. Joia Perry. She's an OB-GYN. She's also the founder of the National Birth Equity Collaborative. It's a nonprofit dedicated to eliminating racial inequities in birth outcomes. Doc, thanks so much for joining me. What was the main factor for Black women receiving these drastically negative outcomes? It's like, if there's nothing biological about us as Black people that makes us more likely to die giving birth, why are we dying more giving birth?
Well, it's racism. We know that despite income or education, even a Black woman who has a college degree is 5 times more likely to die within a year of childbirth than a white woman who has no high school education. So if you think about that, even when we're normal weight, we are more likely to die than a white woman who's obese. Even when we live in a fancy neighborhood, we move into gated communities. I love my other doctor friends who love saying, I went to my fancy HBCU or my Ivy, and now I live in this gated community. Guess what, sis? You're still more likely to die than a white woman who doesn't even have a high school diploma. So despite our income, despite our education, we cannot buy or educate our way out of dying from the impact of racism.
Connect the dots for me, though, because people are going to be watching this and they're going to say, well, how does racism make you die? Well, I don't see it.
True. Well, I mean, your first comments were really important. You talked about the blood pressure cuffs. I liked that segment. That was very important. So who are you going to take the time to put the right cuff on? Who do you care about enough to stop and say, hey, your arm is not the regular size. You have a smaller arm or bigger arm. We know right now that one of the leading reasons that people die in childbirth is a heart attack. Or if you think about Kira Johnson, Charles Johnson's wife, who died, who is Judge Hatchett's daughter-in-law. So think about all the layers of privilege that this woman had. She was a healthy FAMU grad, loved by her husband, brought there for a repeat C-section. And she was allowed to bleed to death for hours. And what the nurse said to his wife, to Charles, was, your wife's just not a priority right now. So even as he tried to advocate for his wife as a Black man with a suit on at a fancy hospital, guess what? The more he escalated, the more they downgraded and didn't listen to him. So that's how you get those outcomes.
Wow. You know, the idea that we don't listen to Black women's pain, we don't trust their expression of pain levels, we're sort of dismissive of them in general. It's something that we experience throughout life, not just in the hospital, all parts of life, but it seems like it's playing out so much in U.S. Hospitals. But the report also mentioned that Black women in Latin America and the Caribbean face racism in healthcare as well. So, you know, why the U.S.? Why do we focus on the U.S. so much?
Well, I mean, the truth is I live here. I'm from New Orleans. And so as a Black woman who's an OB-GYN who's had 3 different complicated births myself, like most Black women, you start an organization to fix your own problem first, right? So I had a son who was born premature, and I started MBAC to say, now, what is wrong with me? I know that there's no biological basis of race. Me having more melanin does not make my kidneys act differently, doesn't make my lungs act differently. All those were racist tropes. I was taught in medical school at Louisiana State University, a publicly funded university, paying state dollars in a state that has a lot of Black folks in it, that there were 3 biological races, Mongoloid, Caucasoid, and Negroid. That was taught in a lecture in class in the 1990s. So
what year was that? Oh my God, that's like early 20th century race science. We still doing that eugenic science in medical schools?
Yes. And then, so even when we get rid of it finally across the United States, guess where we export it? The Caribbean and Central and Latin America. Guess where they get their textbooks from? Our old textbooks. So guess what they're learning? Right. Eugenics, race-based science. So Yes, it's also we don't listen to Black women and we don't listen to Black men. I just don't want to discount that Black men are showing up for their wives, for their partners, just like Charles Johnson did. And even, if you escalate, if you buck, guess what happens? The nurse is going to buck back and nothing happens. And then the police get called on you so many times. People are getting kicked out of hospitals.
Oh, I've seen it.
Security.
I have seen it.
So this is
up close.
This is a real thing. Racism kills us for real. Like, it's not just police brutality. I love to talk to Kimberly Crenshaw about how, like, yes, we talk about what happens in the streets, but the hospitals are also a war zone for us being able to survive and live.
Absolutely. You know, I was my 1-year-old was born.
I didn't. Congratulations.
We were in the NICU. Thank you. We were born. You know, we were in the hospital. We were in the NICU for months. You know, we had the ability to advocate for ourselves in certain kinds of ways, and we were sort of legible to them as people who deserved certain kinds of treatment sometimes. Yeah. But when you sit there for months, you watch different people come in, and I watched how nurses treated different people and how they disregarded people's concerns and people's pain. And I heard people talk about how when they decided to drug test certain people during delivery and not others, and when they sort of weaponized all aspects of the system against Black women, and particularly poor and working class Black women. That's a key thing. But you said something else that I thought was important, which was that you can't behave your way out of it and you can't achieve your way out of it. And we've seen that with celebrities like Beyonce, Serena Williams. They talk about the experiences they've had giving birth. And if they ain't listening to Beyonce, people pay $300 to sit behind a wall to listen to Beyonce at the concert, but they're not listening to her in the hospital. What hope do we have?
I mean, I'm thinking about Serena being pregnant right now, right? So I'm thinking about her. She's married to a very kind of appearing white man who's a billionaire, and yet she almost died. So here she is, knowing her body. If you hear her story, what she describes is that she said to them, typical Black woman, she walked to the nurse's station. She's like, listen, I think I might be dying. Can y'all just give me some heparin because I have a blood clot? And they were like, oh, you just feel faint because you just had a baby. She is a world-class athlete who had had a blood clot before. If you don't listen to Serena Williams, right. So they made her go lay back down. They didn't listen to her for hours. Serena would be dead if she didn't act as what they like to call her as a diva. If she didn't keep saying, no, for real, I need a CAT scan and I need to get first did an ultrasound. They did all these other things to stall. These are things that could have killed her. So then if you are Serena, where do you go now for healthcare? Where do you and your billionaire husband go that you're going to be seen and be valued? So what we say, I'm not all doom and gloom. You really have to find someone who you trust. If you don't trust them, leave, just like you would do with anything else. You don't have to stay with the provider you don't trust. If you don't trust the healthcare facility, go somewhere else. And while you're there, you're constantly negotiating all those things. My father's a doctor, my mom's a pharmacist. I still have to go in hospitals with them with their elder care, and do the same kinds of things to make sure that our elder Black folks can still get powerful treatment.
You ain't never lied. I've had similar experiences. It's just crazy that in this country, it's not surprising, but it's just still crazy that in this country we still have to wrestle with this stuff as Black folk, no matter how hard we work, no matter what we do. Everybody deserves quality health care. Everybody deserves quality treatment. You shouldn't need a degree or a big bank account to get treated well. But it's also important in a country that says if you act right and behave right, you'll get treated right, that ain't true either. Anyway, Dr. Joia Perry, I want to thank you so much for joining me, and thank you for founding the National Birth Equity Collaborative. We appreciate the work that you do.